service. So without further ado, we've got our next speaker, Chris Elkin, who is representing Piota Apps. Piota Healthcare Apps. And after that, we're going to run a short comfort break for you all to get your teas and coffees replenished, just to let you all know. So good morning, Chris. Sorry, good afternoon now, actually. How are you?
Good afternoon. How are you?
I'm not so bad. Not so bad at all. Yeah, just recovering after a London trip last week. Couple of events on, and of course, what's been going on as well. So we've had a mad few weeks really. How's things?
Yeah. Well, great speakers this morning. I've really had really learned a few bits and pieces from the speakers. I think Anton's conversation was great. Really insightful. Absolutely fantastic. Yeah.
Yeah, brilliant. Well, we're glad to have you here on board as well, Chris. And all your presentations always seem to get a really good response. So I'm sure this will be no different at all. So just let everybody know, Chris Elkin is, of course, the head of healthcare at Piota Healthcare Apps, and he's going to be talking you through a couple of their innovative apps that they've delivered within the NHS as well. Quite substantially now across the NHS, aren't you, Chris? You're quite well known now. So, yeah.
Thank you very much, Sean. Right, okay, I'm conscious of time, so I'll get straight into this. I'm sure people are wanting to take their comfort break or get their lunch. So, my name is Chris Elkin. I'm the head of healthcare. I've been within the digital media industry for about 20 odd years now, in some shape or form. Spent 10 years working for the NHS, creating online learning content, a series of apps, learning passports, nursery validation apps. I managed the Trust website and internet for a little while, been involved with comms and engagement. So well versed, I guess, with some of the challenges faced by NHS organisations in the sort of staff engagement sort of area. I'm really interested in making things easy for people. That's kind of the heart of me as an individual. Trying to make whatever it is, whatever these electronic communication tools are, really easy to use, really simple, not getting people to think about it, just it becomes natural for them, they just kind of crack on with it. So really interested in that kind of user experience and making it easy for people. A little bit about Piota. I can confidently say we're one of the leading providers of NHS apps into the health and social care. We've got about 130 apps out there at the moment. Starting with sort of NHS England and Public Health Wales, and kind of cascading down through the different systems, different boards, ICSs, cancer networks, you name it, through the different trusts and different teams. We have an app platform that we license to our clients. So an app in a box, if you will, a DIY app, but all our clients sort of come to us and they're desperate to either improve staff engagement and just reach out to staff that they've found difficult in the past, or create apps specifically for the patients, families and carers. So it's the same platform that we use. It can be repurposed, rebranded, depending on the actual app itself. These are a bunch of sort of screenshots from different apps, but some of these are for staff. This one's for a care home, for care homes in the Black Country, for care home staff. This one's a cancer support app for patients, families and carers. This one's a staff app for the team at Friendly Health. So lots of great apps, lots of experience of working with sort of different teams, helping them to sort of create an app in the first place and launch it and get it out to their colleagues on various different topics. So just as a quick overview, I'm going to go through a couple of demos just to sort of show you the art of the possible at this stage. We would welcome any questions at the end, or if you're interested in what we do and what we've got to say, then please get in touch after the event. So this one's about sort of increasing staff wellbeing and engagement. So we're seeing a lot of these apps at the moment. Part of the problem is, I guess, this sort of digital exclusion we keep coming across, where people who are administration staff have access to a computer on a day-to-day basis, but a lot of sort of clinical staff, estates, facilities type staff potentially don't have access to the computers within the work time. So people aren't necessarily been able to get the same opportunities that are presented on the internet or intranet, because they just don't have the time or the capability to kind of access them. I think these images kind of sort of really tell that story, where people are just using the phones to be able to get information as and when they can, as and when they've got a minute, or when they get back home again. They're using these little supercomputers we all carry around to get information. So this is one of our clients, St Helena Knowsley up in the northwest. They created a staff engagement app, and it was exactly for that purpose. It was to extend the reach of all of the good stuff that was happening within STHK to every employee. So everyone's got the equal opportunities around benefits, around networks, around job opportunities, training, whatever it might be. It's all on the app, and every member of staff has got the ability to download and access it. So as I say, our apps are all the sort of same. We can customize those, so we can have kind of your logo and your branding, and then we've kind of got this 3x3 grid, which we commonly sort of talk about the tiles with these labels and icons. So again, it's meant to be very easy to navigate. Pick this up. It's fairly intuitive. The tiles kind of describe what the information's about, and you can then navigate around the app itself. So as I say, lots of different things are happening within STHK. So just giving everybody a heads up of the different events that are happening throughout the organisation, introducing the different networks that people can people can join and be aware of. And again, a lot of these things are out there, great resources. But a lot of people complain they just didn't know about it. It was on the internet, and they didn't have access to the internet throughout the day, and therefore kind of missed opportunities. So again, having that opportunity, having that availability, or having the app to be able to reach out to people, put everybody on a sort of level playing field. This one provided staff with information about the different systems and resources that are available. So especially during sort of COVID, when a lot of people's workplaces changed, a lot of the information they would need about the different systems that are available were on the app. Things about the benefits that are available to people, some of the organisations that kind of support the hospital, and what you can get and how you can get hold of those. Because it's an app, it's quite a modern way of kind of communicating with people. So you've got things like push notifications and alerts. So I think we look on our phones about 3 hours a day, little glance here, little glance there. And you see those little red bubbles next to your favourite apps with a push notification. And if you're anything like me, I'm a little bit nosy and just want to see what's new. So the hospitals or the team there are no different. They want to ensure that everyone's up to date with everything that's happening, so they can send kind of push notifications out directly to people's phones. And if you've got a smartwatch, I've got an Apple Watch somewhere, the notifications pop up on there. So just a really modern way of keeping people in touch with everything that's happening. Within the tool itself, we've got a sort of forms or a feedback function, so you can quickly create feedback forms. This was a great addition to their engagement tool set. So they created this concept called pulse check, where they're sending out 2 or 3 questions just to kind of get some feedback locally about different subjects. So one bit might be about leadership. It might have been about training, it might have been about sort of COVID and have you got the right PPE, but just 2 or 3 questions, not necessarily a staff survey, but just little sort of questions, little flavours of the month where they can go out, target staff, get some feedback, and if they do sort of start to identify any issues or patterns, they can get transformation leads in there to go and iron out the problems. But again, just creating something that's small, quick and easy to complete, accessible via your phone, just made life a little bit easier for that team. So moving on, very similar again. As I say, all our apps look very similar. This one was specifically for facilities management and estates staff. So your porters, your cleaners, those sorts of folks, security, those sorts of folks. Again, a lot of them didn't even have an email address, let alone access to the internet. So this particular hospital wanted to reach out to their staff. A lot of information, a lot of news would go historically through team leaders and kind of cascade down to the staff. Some of it might have been diluted, some of it might not just get to where it needs to go. So they just decided, after launching lots of different apps in the hospital, that they're going to produce an app specifically for this facilities management team. So all the information they'll need either operationally and or around what's happening within the trust. So with this particular one, as with the others, you need to kind of register first, and once you're registered, you can then start to see all of the content. But again, there's some news about the team and everything that's happening. There is information there about, well, this is winning awards, so good news stories again. This is really good. We're working with the networks team. They've got the ability to actually access the internet directly. So they can click on this link and it takes them straight through via an extranet onto their intranet. So they can access sort of NETI. They've got information about their learning passport, so they can see what training they need to do, and if they're out of date, they can go and find training sessions or e-learning modules they need to complete. A whole heap of information about different aspects of the role. Again, what benefits are available, what networks are available to them. Just a real neat way of keeping them in contact, keeping in touch with everything that's kind of happening. Lots of work has gone into ensuring staff wellbeing and engagement. It's just a matter of making sure everyone's aware of it and they can access it. What else have we got on here? So information about ESR, so they can, while it's not a direct link into ESR, again, there's information here about how to get onto ESR, how to get their pay slips, how to view their record absence details and that sort of good stuff. Again, all this information is available. It's all on the system somewhere. But with all of these, it's when you want to do it, isn't it? As an individual, when you're sat at home, thinking about what's something that somebody told you something, or somebody told you to go and have a look on ESR, or how do I get there? How do I access it? Well, they can pull out their app and all the information's on there for them to go and connect and kind of go and use it. So, it's having that kind of one-stop shop, all the information you need in your pocket, accessible as and when you need it. Push notifications and alerts, so same sort of principle, little tap on the shoulder, some new information here for you. A contacts directory, so all of the different people that they would necessarily need to speak to. Again, make it easy for people. If they've got questions, if they've got a query, they haven't got to go searching around for phone numbers and then trying to transcribe it from one place to another. Click a button, get straight through to that help desk, speak to people, make it easy. That's the least we can do for our colleagues, I think. And then finally, on this sort of staff journey, if you will, this one's more operational. I love this app. This is one that was put together by a consultant with the emergency department team in the West Midlands. But he wants to increase efficiency within the team. Obviously, A&E under significant pressure to see people, more and more people coming in out of desperation. So wherever you can save a little bit of time here, a little bit of time there, it's all balanced up over a longer period of time, and they can be slightly sort of more productive. One of the issues really was, again, access to technology. So within the ED team, a number of computers scattered across the department, but as you'd expect, all being used for clinical reasons, whether it be X-rays or blood results or whatever else it might be. Lots of kind of locums and junior doctors and new stars kind of coming through the team. So our consultant wanted to ensure that all this information was accessible within a couple of clicks from that little supercomputer that's in your pocket or in your tunic or wherever it might be. Historically, if I needed a policy or guideline, wasn't quite sure about something, I perhaps need to go and tap somebody on the shoulder and say, do you mind if you log out of the computer while I log in? It sometimes takes a while to log out and log in. So just being able to provide all that information as and when you need it in your pocket or in your tunic was just a big win for them. So this one has lots of different procedures and policies, everything that you need in there. Again, you need to register onto the app first to be able to kind of get the information. But then there's all the policies, procedures, guidelines. These are all hyperlinks to the different policies. They can click on those, and in a couple of seconds they're kind of open, and they're navigating through them. So, what might take them sort of 5 or 6 minutes, 7 minutes, depending on the machines and the availability, can be done potentially at bedside while you're having a conversation with the patient and just finding the information that you need there and then. So lots of different guidelines, adult guidelines, paediatric guidelines, resuscitation guidelines, so on and so forth. There's information about rotas. So again, coming back to having accessibility to that information wherever you want it. So it could be sat at the end of the day on your sofa, de-stressing, but you can pull out your phone and access the staff rota. It's just making it easy for people. And I think that's what we're trying to do. That's what the heart of what we're trying to achieve in partnership. Lots of different forms. So again, using the form facility that we've got. have the ability to create, annual leave request forms, handover sheets. All these can be completed with a couple of clicks on the phone, and then they can be recorded directly on the system, or then emailed to the administration staff or reception staff or whoever's responsible for any of these particular areas. So again, just making it dead easy for people to be able to kind of close the loop in terms of recording feedback or filling in, handover sheets or whatever else it might be. We've got a directory of consultants, who's who. So, you go straight through to these people's individual phones, or you can send emails out to them. Again, just making it really accessible for people to have a conversation with the right people at the right time. So really interesting app. He's gone on to put on training on there as well, again for new starts or for people coming into the organisation. They can access the training, record the training, information about different sort of colleges and different resources. So again, everything really in one place. His colleagues can pull out the phone at any particular time and get access to this information to do with it what they will. So there were 3 specific sort of apps aimed at staff, a couple really about extending the reach of the intranet, ensuring that everyone's got the same opportunities, everyone's included. There isn't this aspect of digital exclusion because you don't have a computer, it's all on the phone. And the third one was there about sort of using technology to increase efficiency in a clinical situation. We also do a lot of patient experience apps or patient apps. I'll just give you a quick glance at that. Same sort of principle. It's your patients, their families and carers that need to get this information as and when they want it, when they need it, if you will. Again, we've all got little supercomputers attached to our heads these days, so it's just a great platform to be able to reach out to people. This one's for a maternity team up in Morecambe Bay. Same sort of principle, bit of branding, bit of logos in there, and the pathway there for new parents, families, carers, grandparents, etc. all kind of laid out for them to sort of navigate. So the information in here, pregnancy referral forms, videos about different birthing clinics, so you can go and have a little look, see where you would like to come give birth. Lots of different guidance about different areas of giving birth, or after the year of new babies. Again, lots of contacts in there, making it easy for people. If you want to speak to a midwife, press the call button, you can speak to them. You don't have to think about the number, searching around the internet or whatever it might be. It's all there, it's all in one place, it's quick and easy. Push notifications and alerts, as with all the apps, just a really great way of reaching out to people and just reminding them, or making them aware of various different new things that are happening. So yeah, that's just sort of a very, very quick overview. We've got hundreds of apps now, well, over 100 apps now. So if there's a particular area or something you're interested in, come have a word with us, because we're bound to have done something similar for somebody else, and we can show you kind of what they're up to and how they've kind of approached the same sort of challenge. So yeah, come and have a talk to us. But just quickly about the solution itself, 2 aspects. We license you the software, so you've got the app itself, which we customise for you. Put your logos in there, have the tiles, and make it sort of look and feel like it's part of your organisation. Easy to navigate. Another content management system at the back end that allows you or your team to create the content itself. So we're not a content developer. We're licensing you a platform, and then people within your organisation can create the content themselves. And the teams that we work with are kind of desperate to be able to do this, but don't necessarily have the resources available internally to do it themselves. So, IT teams are, not been able to help, or the comms team are not been able to help. So, they want to get these apps out. They own the content. They're subject matter experts. And using our tool, it's a lot quicker, and I think a lot easier, having worked on both sides of the fence, to create the content yourself, as opposed to trying to send an email out to somebody else. Can you do this for me, or can you add that, or can you make a quick edit? You can log into the system and do all that yourself within seconds, within minutes. So it's just an easier way of teams being able to manage their content for their audiences, whether that be staff and colleagues internally, or whether it be patients and families externally. Very quickly, a little bit about process. So, events like this we'll get inquiries from. We can have a quick Teams Google Hangout meeting with you, talk a little bit more about your app or your desire, demonstrate some apps that we've created for other people, find some synergy between what you're looking for and what we can possibly do to help. We can do a free trial, so we'll create an app for you. You can have this for, you know, a calendar month. We'll put some content on there. We'll show you how to update it. We'll provide you with a story, so you can then share that with your colleagues, with your different groups, you know, with patient families and clinicians potentially, get their thoughts, kind of get their feedback. Beyond that, when that's sort of, you know, where you'll do your demonstration, then we kind of go through the formalities of our partnership. I've sort of put there, get an agreement, raise a PO. Just quickly on costs. This isn't very expensive at all. I kind of get, you know, every penny counts. But this is anywhere between £2,000 and £5,000 per year, depending on how many colleagues or staff are going to access this app. So between £2,000 and £5,000 a year. Again, you know, every penny counts, but in the grand scheme of things, it's not a lot of money really for kind of what you're getting, and that ability to, you know, to have an app, get on a digital ladder, and provide, you know, your audience with all the resources that they demand and they should have. So you know, within a day elapsed, we could have this app up and running. And I think the best one we did, or the best one, was the quickest we've done thus far, was exactly that. Within a day, a chief nurse came to us at the start of the pandemic, wanted to create an app for all the care home staff, came to us with the idea in the morning, and by the afternoon she was emailing the managers, suggesting that all the staff downloaded the app to get it onto their device. From here on in, we'll share news, we'll share information about PPE, we'll share information about infection control, we'll share information about this, that and the other. But it was all in that kind of one place. We managed to be able to roll it out relatively quickly with them. I think that is my last slide. So thank you all for your time this afternoon. I'm happy to take any questions you may have.
Thank you, Chris. Can you hear me okay?
I can indeed, yes.
Absolutely perfect. Thank you very much. I had a fair few questions coming in. First one I'd like to start with, not a question, but from Joanne Crawley, who states, currently in the process of having an app built by Piota and can highly recommend the whole experience.
Oh, brilliant. Thank you very much.
Yeah. Yeah, huge thank you, Joanne, and Chris will slip you that £10 later on. So, but no, we've got some questions to go at here, and I know we'll be able to share the slides, Chris. That's right, isn't it?
Absolutely, yeah.
That's perfect. So, Abby has asked a couple of questions here, actually, so we'll get through a few of these. So, question for Chris: do you have any data to show how the staff app has improved engagement and/or well-being?
We don't personally, because we are not, obviously it's not our content. We're not sort of going out to the staff themselves. Obviously we have contacts or our clients who do that kind of stuff, and where, you know, we'd be more than happy to reach out to them and connect you two guys up to be able to have those sorts of conversations. But because, you know, once we've licensed the platform, any of that data is between the organisation and the, you know, and then the teams that are kind of managing it. So yeah, we don't, but we can certainly point you in the direction of people that will be able to give you that sort of information, hopefully.
Perfect. Thank you very much. Just off the back of that, Abby asked a separate question, which was, how well utilised are they by staff for organisations who have implemented them? So Joanne's kind of answered the integration stages. So obviously she's getting implemented at the moment, but any kind of insight into, you know, how staff have utilised it?
I mean, it's always going to be difficult in different organisations and different cultures, and most importantly, the different communications campaigns with a lot of these things. You know, you can have the best platform, the best app, the shiniest tool out there. If no one knows anything about it, you know, they're not likely to access it. So it's all going to depend. There's a lot of variables in there to how successful these things are. Each of the clients do have within the content management system, the back end, a little analytics engine. So they can monitor and they can see themselves how many people have downloaded it, what sections they've been into, what pages they've read. So they can start to create little heat maps themselves to be able to see, you know, who has, well, not who has, who hasn't, because they don't necessarily know the names of all the different people, but the people that have, how many people have, what particular month they've downloaded, how many active users they've had, and whereabouts they're kind of navigating to. So as again, you know, we're not having all that data to our fingertips, because that's not really what we do. We can again point you in the direction of people that have done something similar, and they can share their experiences if that's going to benefit you.
Perfect. Thank you very much. Hopefully that answers a couple of questions there, Abby. I know you mentioned something about cost, but Chris covered that at the end of the session, and you'll receive that via the slides as well. So hopefully all three of those questions have been answered. So a quick one here from Adam, and then we will go into a small comfort break. So Adam May has asked, would the apps link with other software such as Sage, for an example?
As with what, Sage, sorry? Sage, the accounting software, is that what we're talking about? We at the moment, we're looking at integration, we're looking into APIs into different sort of platforms. I guess the ones that we're looking at sort of are your patient administration systems, ESR, those sorts of clinical systems and HR systems. There's no reason kind of going forward in this world of APIs, the application programming interface, where apps can talk to different systems, that we couldn't open up something to do with Sage potentially. I'm guessing you're using that for your accounts or payroll or something of that ilk. If we're talking about the same Sage, we might be talking about something completely different. But yeah, there's that opportunity. We have a development team. We can create those links, those connections. If there's an organisation out there who wants something custom and something specific, then we can get that conversation going, and we can look to see how we can integrate the data in. But yeah, that's for us. I think that's the future, I guess, of our healthcare apps is to have much more tighter integration into different systems. Really providing that rounded one-stop shop, so you can find everything from that that single source almost. So I'm not sure. I didn't get the person's name, but if they want to sort of reach out and have a chat with us, we can certainly talk about Sage integration.
Yeah, no worries at all. Well, that leads us perfectly into the poll. So yeah, that'll be great. We'll just get the poll on screen now for anybody who's interested in learning a little bit more about Chris and his organisation and asking a few key questions, or as Chris rightly said there, continuing the conversation from the question already asked. So the poll is on the screen right now. Thank you very much for joining as usual, Chris. Brilliant session, and we will work with you to share those slides and any further questions and insights from the audience over after the conference. So yeah, enjoy the rest of the day, and thanks for joining us.
Thank you very much, Sean. Thank you all. Have a great afternoon. Bye-bye.
Take care, Chris. Thanks again.
Cheers.
Right, everybody, just polls on the screen right now. It's